Hello, once again. Welcome to Doki T channel, where we strive to give you quality health information. This week, we'll be looking at what your period tells you. So, what is a period? A period is a part of the menstrual cycle where a woman bleeds from the vagina for few days. And for most women, this happens every 28 days. But the menstrual cycle, is the length of time between two periods, that is called the menstrual cycle. This can range from 21 to 35 days. And the period itself, for most women, lasts average of 5 days, but it can also range from 2 to 7 days. And the amount of blood lost from a period or a menstrual period ranges from 20 to 90 mils, which is about 1 to 5 tablespoons. And for most girls or for most females, you expect them to start their periods around 12 years of age. Now, most children are starting earlier because of nutrition, good nutrition, environmental factors. And by 15 years, you expect that most females should have started their periods. But if there is no period at all by 16 years of age, in the presence of maybe the breast or pubic hair, then this is called primary amenorrhea, and this should be investigated. Or there is absence of periods at 14 years with lack of breast, pubic hair, or any sign of puberty, then this is also called primary amenorrhea and should be investigated appropriately. So your period can tell you different things. So starting from the quantity or the amount of blood you lose. So your periods can be heavy or light. So you say your period is heavy if you're bleeding, like we said, 20 to 90 mils. So if you are bleeding more than 90 mils during one menstrual period, or if you're having to use or you're having to change your tampons or your pads frequently, like every hour or 2 hours, or you are using two types of sanitary products, like you're using together at the same time, like you're using the pad and the tampons together so that you don't get flooded or soaked through, then absolutely that means that your periods are heavy. If you're soaking through your clothing or your beddings, your periods are heavy. If you are passing clots that are bigger than 2.5 centimeter, so it's passing clot is common during periods, but it should not be too big. So if it's bigger than 2.5 centimeters, or like a coin, bigger than a size of a coin, then that means that your periods are heavy. As well as if you become tired or you become short of breath, you feel very tired, weak, or people are telling you, oh, you appear pale, you appear white, then that means you're losing too much blood during your periods, and that isn't too good. As also if you need to change your daily activity because of your menstrual period. So for some people, they will have to stop going to work or avoid work or exercise during their period. So you have to adjust or fit your daily activity because of your period. You have to fit it around your period. Absolutely, then that means your period is heavy. And what causes heavy periods? For some people, heavy periods is normal, especially if that is the normal pattern for them. Right from the start of their periods, from their puberty, their periods have been heavy. Then for them, that is normal for them. But for some people, it wasn't so. So their periods were normal, and then they suddenly realized that they were having the features we talked about earlier of a heavy period. In this situation, it may then be caused by conditions like hormonal imbalance, like maybe thyroid problems, over or underactive thyroid. Stress can also cause every period. problems with the womb itself. So, like fibroids, which is growth in the womb, which is benign growth of the lining of the womb, or adenomyosis or endometriosis, which are when the lining of the womb can be found elsewhere. All this can cause heavy periods. And we should not forget medication. So people that are on blood thinners, maybe for blood clots in the lungs or the legs, or maybe to treat heart problems, they are, because their blood has become thin, and they can have they are at increased risk of bleeding, so they can also have heavy periods as well. Then lastly, rarely, but it does happen, womb cancer, which is the cancer of the lining of the womb. In fact, heavy periods can be the first sign of this form of cancer. So absolutely, if you are somebody that maybe your periods were normal quantity, they were not heavy, they were just normal, and then you notice that you've suddenly become heavy, you're flooding through, you're bleeding beyond 7 days, then absolutely you should. And this is lasting. It has occurred consecutively for 3 cycles, and it still doesn't, it's not showing any sign of changing. Then you should be seeing your health professional, your doctor, to have it investigated and looked at. So we've talked about the quantity of the period, then now the frequency of the period. So like we mentioned earlier, that menstrual cycle ranges from 21 to 35 days. For people, this can become irregular. So for most people, their periods occur regularly, so they know when the period is starting, and but in a situation it becomes irregular, they can't really tell the pattern. This is called irregular period. It's common during puberty. This is when the body is just trying to set a pattern to itself, or when a woman is approaching menopause or perimenopause, there can be a change in the pattern of the period. It can become irregular, it can become more frequently, or delay more. Changing your method of contraception also can cause a change in the pattern of your menstrual cycle. It can make it become more irregular. So let's go on to pain. Pain during period, painful periods or pains during periods is common, and it is due to the womb trying to expel the blood. And for some people, this is the normal for them. So right from the onset of their periods, from the big when they started in their when they had their menarche, which is the onset of period, they've had menstrual cramps, so painful periods. This is called primary dysmenorrhea. This is common, and this is not unusual, and it is nothing to worry about. So for these people, all they just need to do is take some pain reliefs during the period. But for some people, their periods never came with pain, so they never had pains during periods, but all of a sudden they then develop pains associated with periods, that before, during, or after periods, and this is persisting beyond 3 cycles, then absolutely this should be investigated. And different things can cause these things, such as problems with the womb itself, like endometriosis and adenomyosis, in which the lining of the womb can be found elsewhere. Also, infections of the female genital tract, which includes the cervix, the mouth of the womb, the uterus, the ovaries, and the fallopian tube. This condition is called pelvic inflammatory disease. It can manifest as painful periods. Fibroids also can cause pains during periods, as well as intrauterine contraceptive device like coils, copper coils. They can also cause painful periods. So that is, and for this, like we said, if this is just happening, you never used to have painful periods, and now you're developing pains during your periods, that is incapacitating. The pain is just out, you can't really cope with this pain, and it's just out of ordinary, then absolutely you should be seeing your doctor. You should be talking to your doctor to get it properly investigated. Lastly, absent or missed period. So when you hear Or I've missed my periods. What occurs to you, especially for somebody that has had normal periods and then suddenly stopped having periods? So the first thing you would think of is, are you pregnant? So pregnancy is the commonest cause of absent or missed period, and for every woman that has absent or missed periods, they should be testing and be checking that whether they are pregnant or not. Other things, other common reasons for absent periods or missed periods are stress, sudden weight loss, by exercising. So when you exercise too much, that can cause your periods not to come, or you lose weight so drastically. So like in people that some people that have chronic illnesses, that severe illnesses, or people that are not eating well enough. So some people that are anorexic, they are not eating, they're starving themselves because they think they are big, they are overweight. That can affect their menstrual period. Then, absolutely, other thing that can cause absent period is menopause or perimenopause. So if you've had regular periods and then you suddenly stopped having periods, you should be talking. First of all, you should check in. Am I pregnant? And if you are not, then you should be talking to your doctor to get it investigated. So these are the things that your periods can tell you. So if you notice that there is a change in your normal pattern, in the usual pattern of your period, and this is become a bother, a worry to you, why don't you talk to a doctor today?